I'm going to be talking about some of the different ways that we treat cancer, so I wanted to give this trigger warning before I got into the video. Now, there are many different ways that doctors will treat patients with cancer. I'm just going to be going over some of the few more popular ways. So the three treatments that I'm going to talk about here have been used a lot in the past, but recently we've seen a transition to new and more effective ways to treat cancer. And the first is chemotherapy, where the doctor will use a powerful chemical to try and kill fast-growing cells within your body. Since chemotherapy uses these powerful chemicals to kill these cells, it's really kind of tough on the body, and there's a lot of side effects that go along with it. You can also have surgery that removes the tumor or cancerous cells. However, this is tough not only on the body, but it's also tough to get all of those cells, because if you just leave a couple cells behind, those cells could form a new tumor. And until recently, it was really tough to tell cancerous cells versus non-cancerous cells because of how identical they are in just their appearance and in nature. You can also have radiation done to kill the cancerous cells or the tumors, but again, this causes a lot of side effects and it's really tough on the body. A new branch of science is really developing within biotechnology, and this is training your immune system to fight your cancerous cells instead of having those previous treatments. This field is known as immunotherapy, and there's a lot less side effects when fighting cancer in this way. Doctors will use medications to train your immune system to build antibodies to target the cancerous cells. This type of treatment can be more successful because it's more individualized for the patient and there are less side effects. But it's also tougher to develop because everyone's cancer is different, and just because one type of treatment will work on one person doesn't mean it's going to work on the next person. But we have seen leaps and bounds in the cancer treatment because of immunotherapies in the past 20 to 30 years.